I want to welcome everyone to this webinar through APPAM and in coordination with universities and the USDA. My name is Mariah Ehmke, and I'm a research agricultural economist here at USDA's Economic Research Service. We are excited to talk to you today about efforts to develop and work with a national measure of nutrition security. To lead us on our journey today in this conversation, we have Shelly Ploeg, the Chief of the Food Assistance Branch and in the Food Economics Division at the Economic Research Service. Shelly is responsible for managing and directing research on USDA's domestic food and nutrition assistance programs. This includes the Supplemental Nutrition Assistance Program, also known as SNAP, school meal programs, Special Supplemental Nutrition Program for Women, Infants, and Children, known as WIC, and lots of work on food security. Shelly has been at ERS for 20 years, serving as a research economist, chief of the Food Assistance Branch, as well as other positions in the agency. She started her career as a study director at the Committee on National Statistics at the National Academies. She's also worked for the Federal Housing Finance Agency and at George Washington University. Shelly has a PhD in policy analysis and management from Cornell University and a BA in economics from Central College. She's been a member of APPAM for over 25 years. I know we'll be in good hands. Thank you, Shelly, for hosting our session.
Thank you, Mariah, for those kind remarks, and thanks everyone for attending today's webinar. Thank you for APPAM for hosting it and for each of our speakers today, and thank you, Mariah, for organizing us. Nutrition security is an emerging concept identified as central to federal efforts to reduce hunger, improve nutrition, and reduce nutrition-related health problems. The success of these efforts hinges on measurement of nutrition security. But currently, there is no agreed definition for nutrition security. An interdisciplinary team of researchers from USDA's Economic Research Service and major universities, some of whom you'll hear from today, has begun to develop a nutrition security measure or system of measurements. A conceptual framework for nutrition security was published in the Annual Review of Nutrition, and the team is now exploring existing data for potential measures. At the USDA, we see this effort to develop nutrition security as similar to prior efforts to develop a measure of food security, which I think is the most important set of statistics that my agency, the Economic Research Service, produces each year. Development of the food security measure began with recognition of a problem that required more data and investigate to better understand the problem and to develop policies and track progress towards addressing it. The process for developing that measure relied on expert research and input, discussion with stakeholders, and collaboration with federal statistical agencies to implement the measure in a nationally representative survey with high validity and reliability. For over 25 years, we have been measuring food security in the US, and the statistics are a key indicator of the extent to which USDA has met its strategic goal of providing all Americans with safe and nutritious food. To develop a measure of nutrition security that will complement our existing measure of food security, our team is now engaging further with other researchers and stakeholders to ensure that diverse perspectives and experiences are being incorporated. Part of our goal today is to engage with the APPAM community, to seek input on the concept and measures as they are developed, and consider the potential uses of a nutrition security measure to assess the nutrition security status of the US population and important subgroups, and to inform policies and programs to improve nutrition and health. Towards that goal, we are honored to have Dr. Caree Cotwright here with us today to kick off this webinar and tell us about the USDA and federal government's efforts to measure and address nutrition security. Dr. Cotwright serves as a Director of Nutrition Security and Health Equity for the Food and Nutrition Service at the U.S. Department of Agriculture. In this role, Dr. Cotwright leads a whole of department approach to advancing food and nutrition security. She also serves as one of 2 departmental representatives on accelerating action on the White House Conference on Hunger, Nutrition, and Health Goals to end hunger, improve nutrition and physical activity, and reduce diet-related diseases and disparities, implementing a corresponding national strategy. Her work includes building public awareness of USDA's actions to advance food and nutrition security, as well as collaborating and building partnerships with key stakeholders to maximize our reach and impact. Dr. Cotwright is on leave as an associate professor of nutritional sciences at the University of Georgia's College of Family and Consumer Sciences, Department of Nutritional Sciences. Her research centers on promoting healthy eating among infants through age 5, with a particular focus on accelerating health equity among historically underserved populations via community-based participatory research, and focusing on developing, implementing, evaluating, and sustaining best practices and policies in the early childhood education setting. She has developed a variety of innovative interventions which use theater, media, and other arts-based approaches. She's the author of numerous peer-reviewed publications and secured over $1 million in grants focused on obesity prevention and health equity from Healthy Eating Research, a national program of the Robert Wood Johnson Foundation, and the USDA. From 2010 to 2013, she worked as an ORISE research fellow at the Centers for Disease Control and Prevention, Division of Nutrition, Physical Activity, and Obesity, where she was highly engaged in early care education elements of former First Lady Michelle Obama's Let's Move initiative, dedicated to helping kids and families live healthier lives. Dr. Caree holds a PhD in food and nutrition and community nutrition and an MS in food and nutrition from both the University of Georgia, and a bachelor's degree in biology from Howard University. She's a registered dietitian nutritionist. She lives in Athens, Georgia, with her loving husband and adorable 3 daughters. Dr. Cartwright, I'll turn it over to you.
Thank you. Thank you so much, Shelly, for that kind introduction. Thank you so much for allowing me to be here today. I am so happy to kick off this webinar because I know there's so much interest in this topic. We are so grateful to ERS's leadership in food security measurements, as well as their leadership on assessing and monitoring nutrition security in the U.S. As a nutrition security researcher, I'm excited to be a part of this webinar and to hear from our esteemed panelists. So today, I'm going to provide a brief overview of why USDA has made tackling food and nutrition security a core priority for our department. I will also highlight how we are operationalizing this concept with a unique, first of its kind, department-wide approach. So at the core of USDA's approach to advance food and nutrition security is the administration of 16 nutrition assistance programs. These programs are the most far-reaching, powerful tools available to the federal government to ensure that everyone in this country has access to healthy, safe, and affordable food. Now, our programs reach 1 in 4 Americans, but we know we can do more to improve the health of our nation, and we need your help. At USDA, we are working to build awareness among our staff and key partners about the sizable body of research indicating that structural racism harms health in ways that can be described, measured, and dismantled. And we are also examining our existing and potential policies to identify ways to prioritize health equity and to address the social determinants of health. This is where nutrition security comes in and where we at USDA and each of you here today can have influence. Our work includes having each of our agencies across the entire department develop equity plans, as you can see here. We also established the first USDA Equity Commission and are holding ourselves accountable to external feedback on how we can do better to advance equity. Just last week, I was in Washington, D.C. for our department's inaugural National Equity Summit. This hybrid event celebrated the USDA Equity Commission, which delivered its final report to our Secretary of Agriculture, Tom Vilsack. Sorry, I had a little pop-up come up. The summit also served as a platform to highlight the progress made under the Biden-Harris administration. I'm so sorry. something keeps popping up. I don't know if you can see it, but there's a little survey that's popping up as well, which is great. But the summit also served as a platform to highlight the progress made under the Biden-Harris administration to enhance access and inclusion in USDA programs and services. The summit also included a nutrition security panel that Acting Undersecretary Kumar Chandran moderated among myself and Deputy Undersecretary Stacey Dean, Heather Dawn Thompson, who serves as the Director of the USDA Office of Tribal Relations, and USDA Equity Commission member Elizabeth Lauerbosch, who is the Deputy Executive Director for Policy at the Center for Law and Social Policy. Just yesterday, I was also back in Washington, D.C. at the White House, where Secretary Vilsack helped to celebrate 141 new external commitments totaling $1.7 billion, which is so impressive, of new investments that will help us to implement the national strategy on hunger, nutrition, and health. Released the day before the historic White House conference, this strategy was designed to help end hunger, improve nutrition and physical activity, and to reduce diet-related diseases and disparities. It was such an exciting day. The energy was electric, and hopefully it gave many of the public policy experts listening today food for thought for ways that we can evaluate the impacts of these new investments, but also to inspire new and innovative ways that we can do better together. Without question, we are proud of our efforts to date, but we know we have a lot more work to go. And we know we'll be able to do better and go further and faster by taking a whole of society approach that includes you, and especially your help on developing tools to better assess and to monitor nutrition security. These types of metrics will be foundational to truly capture the impacts of this growing whole of society approach to helping everyone in this country to thrive. While working to advance equity, we are also emphasizing how improving what people eat is critical for all demographic groups and life stages. Poor nutrition causes more than 600,000 deaths in the US each year. Besides this, the toll of these diseases is taking on losing members of our families and our communities far too early. When we think about diet-related chronic diseases, accounts for 85% of healthcare spending in this country. This is preventable and this is solvable. Since launching our Food and Nutrition Security Initiative about a year and a half ago, the USDA has come to define nutrition security to mean that it is ensuring everyone in our country has consistent and equitable access to healthy, safe, and affordable food that is essential to optimal health and well-being. This definition builds on research underway by the USDA Economic Research Service, as well as meetings with more than 200 organizations reaching more than 10,000 stakeholders. Although the wording has been refined and may be further modified, the department's two core motivations for this evolution have remained consistent. The first is the promotion of health equity, which means that everyone has a fair and just opportunity to be as healthy as possible. The second is the recognition that structural inequities make it hard for many people in our country to eat healthy and to be physically active. Our food and nutrition security work at USDA is scaffolded by the following four pillars that are illustrated here. First, we are working to provide meaningful nutrition support from pregnancy to birth and beyond. Second, we are working to connect everyone in this country, I'll say it one more time, to healthy, safe, and affordable food. Third, we are developing, translating, and enacting nutrition science through partnerships like making My Plate a household name. And fourth, and throughout all of this work, we are prioritizing equity every step of the way. As a researcher, I have truly been impressed to see upfront how our work has been driven by research and how it is grounded in science. It is woven into USDA's policies, informs each of our department's decisions, and most importantly, influences every life touched by the federal nutrition assistance programs, among other department equities. As I wrap up, I want to emphasize how thankful we are to this association and our listeners today for all you are doing to help us better assess and monitor nutrition security in this country and to help everyone to thrive. I look forward to our attendees' questions and hearing about your work in this area. Again, thank you for this opportunity, and we appreciate it so much. I look forward to hearing from you. Thank you.
Thank you, Dr. Cotwright. Thank you so much for taking the time to spend with us today, and we look forward to having you available for questions later. Our next speaker is Ed Frongillo. Ed is going to be talking to us about the process of building a nutrition security framework. Dr. Ed Frongillo conducts research globally to learn how to improve growth, development, feeding, care, and survival of children. And he leads research on child, adult, and household food insecurity. His research program also aims to understand how to advance policy and programs for improving food security, nutrition, and development. He has several global and national leadership roles in developing nutrition science and monitoring nutrition in the population, including coordinating with the United Nations Healthy Diets Monitoring Initiative. Without further ado, I'll turn it over to Ed. I think you're muted still, Ed. We can see your slides though.
Sorry about that. All right, we will do this again.
We're good. Yeah.
All right. Okay, thank you.
Terrific.
So I'm going to be talking about kind of the foundation or basis for how we're thinking about constructing a system for assessing and monitoring nutrition security in the U.S. And I've listed here the team of the folks from ERS who are collaborating with 2 people from the University of California, San Francisco, and then 3 of us at the University of South Carolina. So as Shelly already pointed out, we know that the data are important because they produce visibility and they inform action. And problems are invisible if we don't have targets and we don't have standardized data collection systems to produce the data. And one of the great successes we've had, one for which USDA took a lead role and is responsible still for nurturing, is for food insecurity. And we have data. This graph shows data over the last 20 years showing how food insecurity prevalence is responsive to what's going on in society. And so this has been an important advancement, and it didn't happen overnight. So to just give you a quick idea, back in 1984, the President's Task Force on Food Assistance cited the need to be able to have a way of measuring or indicating this. And really work started in earnest in '89, especially about how to conceptualize food insecurity and hunger from the Life Sciences Research Office. The National Nutrition Monitoring and Related Research Act was passed in 1990, which mandated moving ahead with this. And then in parallel to this was some groundbreaking qualitative work that Radimer, a doctoral student at Cornell, did, and then also the Community Childhood Hunger Identification Project. They published their work in '92. And then around the same time, USDA commissioned a group of us at Cornell, because I was there at the time, to do a research and validation study, which provided the initial evidence for the validity of the strategy or the method for assessing food insecurity that we still use and is used worldwide. And then the effort was launched specifically in January 1994 when USDA, in collaboration with Health and Human Services, convened an expert and stakeholder consultation. That was a wonderful meeting for a day and a half and really got everybody on board, both experts and advocates and others, to endorse moving ahead. And then a team was appointed. I had the fortune of being part of that team that was responsible for developing a questionnaire and then fielding it in the current population survey. It took about 2 years to collect that data and then analyze it to create what we now know as the Food Security Survey Module. And as was mentioned, that's been reviewed by the National Academy of Sciences. And USDA has done a fantastic job of getting it put into various of the survey mechanisms that are out there. So in general, the challenge that we face, not just for nutrition security, but anytime we want to establish a national or even global assessment and monitoring system is to achieve consensus on what are the purposes and decisions that require this, what needs to be assessed. In other words, what are the concepts, constructs, subconstructs for which purposes and decisions, then how do we do that? In other words, what methods we use, which measures and indicators are suitable, how are we going to collect them in data systems, and then in the end, it's not helpful unless it's used, so how do we ensure that those who could benefit from using this information do so? There's multiple population purposes that are possible. The first two at the top are in red are the foundational ones in a sense, because we want to be able to assess the prevalence or burden of nutrition security or lack of nutrition security. And then we want to be able to see how that changes over time, which is monitoring. But it's important that we get that information also because it will help in particular inform the design of actions and the targeting of who's going to receive which actions. So in the first piece that was published last year in the annual review of nutrition, we laid out a conceptual framework for how to place nutrition security, how we thought in terms of assessment and monitoring, we should place nutrition security in amongst the other important concepts that we've been discussing, including food security. And so you see that in the figure that's on the right, where in the middle there is nutrition security, and it shows that comprises a healthy diet and nutritional status. But before that is food security, and food security we expect is related to nutrition security, but is distinct from it. And then coming before that are individual and then household and then societal system factors and policies and structures that would affect all of this. And we're concerned about this because it will relate to, at the bottom, individual physical and mental health, and then in the aggregate population health. And on the left are just listed some examples of what some of those factors might be. So our focus is, what do we really mean here by nutrition security? So that's what I'm going to develop now. Before I do that, I just want to make sure we have some terminology understood. So in the social sciences, a construct, in the physical sciences, we call it a property. But in social sciences, a construct is a phenomenon of theoretical interest that's real, but may or may not be observable. So food insecurity, for example, is a construct. We know it exists, although we can't walk down the street and necessarily see it there lying on the street because it's largely unobservable. Measures are a way of assigning numbers to represent relations among people or things with respect to a specific construct or property. And so an example of that would be an amount, or perhaps a degree of severity, something like that. And then an indicator is often derived from a measure to demonstrate something about a construct. It implies understanding what's better or worse, and so an indicator is often binary. It doesn't have to be indicating the presence or absence or something. So the constructs for nutrition security in our way of thinking about it is that there are two. There's healthy diets, which has to do with the food constituents that are consumed, and nutritional status, which is the accumulation of those constituents in the body and whether or not they're at the levels that are required to support health. So we'll try to unpack both of those ideas. So for healthy diets, the subconstructs of the construct of healthy diet are these six. And this comes from, in its origin, a monograph from Aramond and Deichler, a very nice piece of work that they did that we've modified just a little bit. And we've identified these six subconstructs. The first is adequate nutrient intake without that's being met for all nutrients without excess. Nutrient density, richness in nutrients, moderation in the intake of foods and nutrients that are associated with disease, macronutrient balance of among energy from carbohydrates, proteins, and fats, diversity of foods, because we know that not only does diversity of foods help ensure adequate nutritional intake, but there's also components in foods that are bioactive that are important in their own right. And then safety. In the US, our food supply is largely, food safety is not a widespread problem, although there are sporadic problems like children being exposed to lead recently from applesauce. So we're focusing really on the other 5 in this effort. For nutritional status, the subconstructs are the sort of traditional ones: energy, protein, essential fats, vitamins, and minerals. In thinking about healthy diets, we came to the realization, and there was some important input from this from the head of nutrition at the Food and Agriculture Organization, Lynette Neufeld, the importance of differentiating healthfulness of diets from dietary patterns and from adherence to dietary guidelines. So by healthy diets, we mean on the left a set of core underlying construct and subconstructs of what constitutes healthy for the human body, with the understanding that this is universal for humans. No matter where you live, biologically, we're more or less the same in this regard, and therefore this is universal. Dietary patterns in the middle are the way in which foods are combined over a time period, and it's highly contextual. It's influenced by many things: access, culture, traditions, and it can be motivated by factors other than or in addition to healthfulness. And then on the right, adherence to dietary guidelines is whether foods are consumed in accordance with guidelines, but we know guidelines can change. They modify over time as we learn more. And common measures like the Healthy Eating Index combine subconstructs in order to create that single index. To try to illustrate all of these ideas, I'm going to adopt an example. This is actually a global example that has to do with dietary diversity. So there's demographic and health surveys that are collected in many, many countries every year. That's the data collection system. Those surveys implement questionnaires, so that's the method. And one of the measures that's in the questionnaire is food group diversity, the number of food groups that is consumed. It's how many out of 8 for children and how many out of roughly 12 for adults. And then an indicator is formed from that about minimum dietary diversity. So for young children, is it at least 5 out of the 8 food groups. So how do we use that information? Well, we want to use it for interpretation and action. In this case, an example might be to promote animal source foods in places where animal source foods are not commonly given to young children. So what are we doing in our work? Besides the conceptual piece that we've mentioned, that's already out there and readily available in the Annual Review of Nutrition, we're conducting an evidence review that we're about to submit to a journal, where we've asked, trying to understand the interrelationships of the subconstructs of healthy diets and the subconstructs of nutritional status. That's the first bullet. So that we understand where are redundancies in information and what information is additive to other information. And then the second question that we're asking is how the subconstructs of healthy diets and nutritional status, how do those relate to food security? How do those relate to health outcomes? So food security, which we saw in the conceptual framework as a predecessor of nutrition security, and health outcomes, which we expect are result from nutrition security or follow from it. And then the third bullet is about which brief measures and indicators of nutrition security and combinations of them are feasible for population monitoring. And then additional work that we're currently doing is to further confirm this conceptual model of nutrition security, to understand if this way of thinking about it it holds and the data are consistent with it. To identify gaps in existing data collection systems and current measures, and then to develop a plan to alleviate those gaps so that we will get the information that's important. And then third, to then use that to start designing a monitoring system. And some of the questions that we need to ask there are, for example, should nutrition adequacy and moderation components be measured independently or combined like they are now in the Healthy Eating Index and some other metrics? Can we use brief instruments to assess healthfulness of diets, the brief instruments that could be put in many kinds of survey systems. One of the reasons why food insecurity has been so successful is that the questionnaire is short enough to be included in a number of data systems. And then at the bottom, can we use, in relation to that, the National Health Interview Survey implemented some brief instruments about healthfulness of diets starting in 2022. Those data just recently became available, so we'll be looking at those data. Can we use that as a data collection system in addition to the Health and Nutrition Examination Survey, which is more periodic and of course a higher burden in terms of data collection. So that's basically an overview of the effort that we're engaged in. And you know, following from this, Mariah, there's a couple of other talks that you will hear, and Mariah in particular will talk about some of the efforts to engage stakeholders, because all along the way we want to engage with the people who are knowledgeable about this, but also who are likely to be users and to be making decisions based on what we design. So thank you.
Thank you, Ed. At this point, maybe I will pause for a moment, and if there's any questions for either Ed or Caree, we'll have time at the end, of course, but if you have some burning questions now, we can take a little break in between speakers. If anyone has any questions, please raise their hand or put it in the chat. Okay, well, I'll make that as an assignment to you for before our Q&A at the end to then have some questions so we can have a good discussion. Okay, so we'll move along. Our next speaker is Sean Cash, and he's going to be talking about the potential role of a nutrition security measurement in food policy and in research on food related to food policy. Sean is economist with the Friedman School of Nutrition and Policy at Tufts University, where he was the chair of the Division of Agriculture, Food and Environment, and also holds the Bergstrom Foundation professorship. His research focuses on how food, nutrition, and environmental interventions and policies affect consumers and other stakeholders. Ongoing and recent projects in this area include research on the role of dollar stores in food acquisition, food assistance payment impacts on food purchasing patterns in scanner data, the efficacy of food label and price interventions as public health and environmental tools, children's food choices in commercial and school environments, consumer interests in cellular agriculture, food labeling of ethical attributes of food production, online food retailing, and how point-of-sale health messaging impacts consumer demand for food. He's got a full agenda, and we're really thankful that he took the time out from that to talk with us today. Dr. Cash has been the principal or co-investigator on over 22 million of research funding. His work has been funded by the US Department of Agriculture, the National Science Foundation, the National Institutes of Health, the Federal Emergency Management Agency, the Canadian Institutes of Health Research, Agricultural and Agri-Food Canada, and Newman's Own Foundation, among other sources. At the Friedman School, he teaches courses in statistics, environmental and food economics, and corporate social responsibility. He is the founding chief co-editor of the Food Policy and Economics section of Frontiers in Nutrition, and previously served as editor of the Canadian Journal of Agricultural Economics. Thank you, Sean, and we look forward to hearing from you.
Thank you so much, Shelly. I just want to confirm that everyone's seeing my proper slide screen. Okay.
Yes.
Apologies up front to everybody. I had a bit of a sore throat today, so I hope my voice holds out for all of this. But maybe it'll be a blessing to everyone if it doesn't. Thanks for your attention. As Shelly mentioned, a lot of what I work on at Tufts is consumer behavior around food, environment, and nutrition. And as such, I was invited onto this panel not as an expert in either food security or nutrition security per se, but rather as a member of the broader food policy research community to talk about some of what I see as that promise of developing and validating widely accepted measures of nutrition and security, and what types of things we'll be able to achieve when we have these measures in hand. So in the next few minutes, I'm happy to share some of my thoughts on this. but with absolutely no claims whatsoever to being a definitive voice on the matter. That said, I'm personally very excited by the potential of how these measures can enable better research, practice, and well-being in the years to come. Sorry, one moment. There we go. And before I go any further, I did want to disclose the sources of my recent research funding. These research funders do not have any role in the preparation of my comments today, and I have no other relevant or material financial interest to disclose. So as we've already discussed in some detail today, nutrition security is a broader construct that encompasses food security and is concerned with the nutritional adequacy of the food rather than just the availability of calories. There are a few definitions out there, but one that I think many are coalescing on, and I've seen on the USDA Food and Nutrition Service website, is that nutrition security means consistent access, availability, and affordability of food and beverages that promote well-being, prevent disease, and if needed, treat disease, with special attention to making sure that that is accessible to all people. And while today's webinar is focused on nutrition security, I did want to comment that I see the move towards establishing tractable measures of nutrition security in the United States as very much in line with the broader trend, both in the broader research community as well as globally, toward trying to better measure the impacts of food systems on the quality of our lives and environment with more integrated measures. There's an exciting and vibrant research community that's developing and improving measures of what's being called food system sustainability, but it's become a much broader concept than just environmental sustainability. These efforts in this literature still have their biggest footprint in measures of environmental impacts of food production, but there's become a growing understanding that a truly sustainable food system is not just one that operates within planetary boundaries, but also must be accessible to all people and sustain human health and human livelihoods. Poor diets are the main contributor to the global burden of disease, accounting for 20% of premature disease-mediated mortality worldwide, and with more than 3 billion people suffering one or more manifestations of poor nutrition, such as undernutrition, overweight and obesity, and/or micronutrient deficiencies. The environmental impacts of dietary patterns are already transgressing several important planetary boundaries, with these impacts projected to grow substantially by 2050 in the absence of rapid large-scale mitigation. And a significant fraction of the global population farms, fishes, or labors in food value chains, often performing low-wage and dangerous work insufficient to provide food security for the very people who are providing it for others. And of course, most of the world's population accesses much of its food through market-driven systems, which means that affordability is important worldwide. So in the most literal sense, if we cannot afford to sustain ourselves and our households, then our food systems and diets are not sustainable. I'm involved in a project at Tufts that we call the Lasting Project, that's looking to develop metrics that encompass what we say are 4 pillars, being health, environment, livelihoods, and affordability. And I just very much see the parallel in that work we're doing, and also what some of the challenges are in implementing nutrition security measures. And I see moving the concept of nutrition security towards these such tractable measures being really important. Addressing food security, of course, is crucial, but it's a necessary, not a sufficient condition to ensuring well-being. In a little bit, I know we're going to hear from Dr. Ehmke about USDA's efforts in developing and validating nutrition and security measures, and I really have no interest in taking away any thunder from that, but I did think it'd make it a little more concrete for some of the next few minutes to acknowledge the recent work of various research teams in trying to develop and validate tractable short-form screeners of nutrition security. For example, Eric Calloway and his colleagues at the Gretchen Swanson Center have developed a 4-question screener that addresses nutrition and security by posing the following questions about, in the last 12 months, I had to eat some foods that were not good for my health and well-being because I couldn't get other types of food. I knew there were things I should or should not eat for my health and well-being, but could not get healthful food. I worried that the food I was able to eat would hurt my health and well-being, or I had to eat the same thing for several days in a row because I didn't have money to buy other food. In each case, respondents with this instrument are asked to respond with never, rarely, sometimes, often, or always. And the resulting scales range from 4, that is always answering always to all 4 questions, which would represent a high level of nutrition insecurity, to 0, which would be consistently answering never to all 4 questions and would represent a high level of nutrition security. There's a lot more information on the Gretchen Swanson Center's measure and instruments. They made them available on their website, and there's also an article from 2022 in Appetite on initial validation of these measures. Another example of a very short screener is the one being developed and tested right now by my colleagues at Tufts at the Food as Medicine Institute. And this effort's led by Dr. Renee Rydberg, and it's in collaboration with Kaiser Permanente and the Los Angeles Department of Public Health. And you can see in the short form, the very short form of this, where some of the interest might be from folks in healthcare and healthcare systems. So at its heart, there's a single question screener that asked respondents to consider how hard it was for them to regularly obtain and eat nutritious food to support their well-being in the past 12 months. And they're still fine-tuning the scoring on this project, but one approach that they've been looking at so far, and I'll show you a little bit more in a few minutes, is that responses of very hard, or somewhat hard to the single question could be considered as nutrition insecure. So obviously this measure is a very brief one that does not invite as much input as something like the 4-question instrument we just looked at, or some of the food security measures that we're familiar with. That have been standardized now for some time. But the brevity of the screener potentially allows it to be inserted into a very large number of other data collection activities. I'll show you a really neat example of this in a minute. I can't take any credit for it, so I can crow about how cool I think it is. So this screener also includes a second question that gets at barriers to nutrition security. So there are more than a dozen possible options for the second question. It includes things such as healthy foods being too expensive, not enough healthy choices at the stores where people usually shop, lack of transportation to stores or pantries that have healthy foods, lack of knowledge, etc. Dr. Rydberg and her collaborators have been testing this instrument in several studies and surveys right now, and they also provide additional information and documentation on the Tufts Food as Medicine Institute website. I encourage you to check that out. So this is an exciting aspect of what I think you can do for. There's a lot of things I think we could criticize about such a short screener, but some of the benefits is, for example, the ability to include these screening questions into other existing data collection activities, such as those tied to clinical settings. So, for example, the Tufts Food as Medicine Institute team has been testing this screener in different programs and clinics operated by Tufts Medical Center and its affiliates. So you can imagine having this broadly tied to electronic health records and health record systems would open up huge potential for screening, evaluation, and research if we had a standard set of measures that were being delivered consistently in this way across the country. So of course, as important and interesting as these two examples that I just provided are, we're still some distance away from having converged on broadly accepted measures of nutrition insecurity. And just like Dr. Frongillo discussed with food security measures, I'm pretty sure this is going to happen again most successfully with the leadership of USDA and in coordination with key members of the broader research community. So for the remainder of my comments today, I'll focus on identifying some examples of how we in the food policy research community might use such nutrition security measures, hopefully in the near future when they're available and we all agree on them and their quality. So at the risk of being very obvious in the next few minutes, I'm going to point out that we're probably going to use these in any and all of the same ways we utilize other validated measures. And I don't mean to be glib, but where do we use them? We use them on the left-hand side of our models, the right-hand side of our models, and in the middle of causal models. In other words, as explanatory variables in correlational and reduced form analysis, as outcome measures, and there I think the potential for what could be done with this if we have a nice standardized set of measures is really huge. And then to better understand causal relationships in the generation of health and well-being, even outside of areas that might be traditionally thought of as food and nutrition policy. So as far as explanatory variables and correlational and reduced form analysis, one obvious set of applications might be around how nutrition insecurity relates to key disease and other health outcomes, such as type 2 diabetes, stroke, cancer, heart disease, or body weight status. And to the extent that nutrition insecurity is a leading indicator, or perhaps even a predictor of these outcomes, I think it's really interesting to think about how broad-based application and collection of these measures can be an important tool for screening of individuals at risk, such as in those clinical settings, but also in other settings, or really needs assessment at the community level. And there's a really neat talk that I watched, I was preparing some of my comments here, from some folks who have been borrowing the Gretchen Swanson Center measures for exactly that community level needs assessment. So going back briefly to Dr. Rydberg's work at Tufts, and I'm sharing these very preliminary results from a national survey with her permission today, just as an example. But you can see there are really interesting correlations, even from their simple nutrition insecurity measure I described earlier, and how that relates to the prevalence of certain health conditions. For example, only 35% of respondents in a national survey who reported having high blood cholesterol also reported being nutrition insecure using their measure, whereas 65% of respondents who had experienced stroke reported nutrition insecurity. And again, these are just simple correlations, and it's just one example, but I think this opens up a really interesting universe of questions and relations that we'll really only be able to begin to understand once we have widely accepted and validated measures. So another important set of applications of such measures will be as outcome measures for assessing the impact of interventions and also of the food environments in which people operate. At the individual level, nutrition insecurity measures can, and I think will, be an important measure of the success or impact of participation in our federal nutrition support programs. I think 10 years from now, there's going to be a lot of NIH proposals that are saying nutrition insecurity changes are going to be a primary outcome of various RCTs and interventions being proposed. But these might also become important outcome measures for other applications, such as community-based food access interventions, changes in food retail competition and the food retail landscape, food as medicine interventions, such as medically tailored meals and produce prescription programs, food literacy differences or educational interventions around food, and the impacts of technological innovation, whether that be in the production of food, the processing of food, storage of food, any number of things. So I think the potential here is very broad indeed. Just thinking about some of my own work about how consumers behave and the impact of novel food environments, such as the rise of dollar stores in the United States or the global growth in online grocery and food delivery apps. I think having nutrition insecurity measures that are well understood, broadly validated, and broadly accepted would be really useful for truly understanding how some of these changes may be helping or harming the people who are experiencing these differences in how they acquire food and the environments in which they acquire them. And then, as many on this call already know, the last few decades of research on food security have led to a better understanding of associations with important outcomes such as mental health, academic achievement, disease outcomes, and healthcare use. Many of these relationships where our understanding has been facilitated by having these broadly validated measures of food security may actually be better understood by investigating the mediating effect of nutrition insecurity rather than food insecurity measures. As such, establishment of standardized measures will allow us to better understand these causal relations. Examples of these types of questions that might be addressed here include impact of school breakfasts on test performance, impact of increasing minimum wage on infant health, impacts of unemployment on healthcare utilization, and socioeconomic status and depression. These are all things that have been investigated in the context of food security, but I think are perhaps better understood in the context of nutrition insecurity. Having these broadly available measures of nutrition security not just help us understand the role of nutrition in these outcomes, but they allow us to separate that out and to better identify the true role of other mechanisms at play in each of these relationships. So I'm about to wrap up, but in summary, I do believe that new screening tools and interventions for nutrition security can enhance and complement efforts to address food security, but will also open new avenues to researchers to both understand causal relationships in our food systems and build a better evidence base to inform policies, programs, and interventions. My comments today outlined a few, perhaps more obvious ways in which these measures can better inform both research and practice. And I'm sure that many of you on the panel and in the audience have far more intriguing and impactful ideas than I on this as well. I look forward to hearing some of them in the rest of today's conversation, but I appreciate being invited to participate today and for your time and attention. And here's where you can reach me if you want to connect after the webinar.
Thank you, Sean. We have time for a quick question for Sean, if there are any out there. Okay, we'll save them for the final question and answer series. Our last scheduled speaker today is Dr. Mariah Ehmke, and she'll be talking about USDA efforts to create a nutrition security measure. Dr. Ehmke is a research agricultural economist in the Diet Safety and Health Economics branch of ERS of the Department of Agriculture. She's an area expert in the economics of obesity. Her research focuses on consumer behavior and demand related to the economics of obesity, the food system, and nutrition security. At ERS, she works closely with fellow researchers examining new approaches to measuring nutrition security. She has a PhD in agricultural economics from Purdue University. Mariah, I will turn it over to you. And don't forget to unmute yourself. Your slides are showing up.
Mariah, you need to pull your microphone down.
Thank you. Okay. Getting all systems going. Thank you. I appreciate the introduction, Shelly, and I am very pleased to get to talk to you today about the USDA efforts to create a nutrition security measure. At the end of this presentation, I'll introduce more of my team members, but this is definitely, I view the federal government as one of the biggest teams in the world, and this is definitely a team effort that I am representing today. And so, there we go. So as has previously been identified by some of my colleagues, nutrition security is this general concept that means all Americans have consistent and equitable access to healthy, safe, and affordable foods essential to optimal health and well-being. I like to think of it as a bridge from diet and diet quality and food access to good, like optimal public health and well-being. My colleagues and I have been working together to develop a nutrition security metric or a system of measures to assess and monitor nutrition security in the United States. And as Ed described when he was talking, or Dr. Frongillo was described when he was talking about the development of the food security metric, this is a multi-stage process. And generally, we think of it, this process, in terms of a design thinking and scientific framework. So we have been working on the left-hand side of the framework that we're working with, where we spent a lot of time over the last year conceptualizing nutrition security. That's led to the development of the framework and synthesizing related research. We have ongoing efforts to do, say, meta-analysis of existing studies and measures that are available, and seek stakeholder input. Especially today, we're looking forward to hearing from you in the Q&A answer session to see what you're thinking about nutrition security. We also then have worked on articulating the problem, as we hope we are doing today, in terms of the challenges and opportunities that exist with developing our measure and ideating the problem. So we're moving into this stage, and that's the area where I've been working a lot with, is looking at the framework and the definition that have been developed, and trying to work with others to think about how this can be measured. What already do we have in our tool bags that might be useful, and what might we need to expand upon to make something more meaningful? Over the next year or so, we hope to be moving into more of the prototyping process of building measures and providing analysis of those measures to try to see what they can tell us that would inform policy the way Dr. Cash described. Then really all of this is a, you'll see the scientific process arise here as we move into the right-hand side of this diagram and thinking about testing the measures, which will then inform and probably lead to revision and refining, and eventually completion of a process and approval to use measures for federal analysis. So I just wanted to tell you a little bit more about what we have done so far, and sort of for those of you who are working in public policy management, sort of what we have been doing on the federal government side and managing this process across the government. So we have representatives that serve, it's on the Interagency Committee on Human Nutrition Research, and there's a special subcommittee that's been assigned to nutrition security there. So Dr. Joan Guthrie has served from ERS to that committee and is coordinating with a number of different agencies, including those from Health and Human Services, even the Department of Defense, to try to understand what is driving and what is of interest in the nutrition security sphere. Then within the USDA, we have been collaborating, I say we as the Economic Research Service, with researchers at the Food and Nutrition Service and the Center for Nutrition Policy and Promotion we worked with them as they developed, and we developed the definition that you saw earlier. We're working on baseline measures, and I will describe this in a minute, sort of cataloging the data that we have available and understanding how it can, what it can do for us and what the limitations are. And then where we've brought in academic researchers are with projects such as a USDA strategic priority grant, where that is what brought in Dr. Frongillo from University of South Carolina. And we've also worked with Dr. Hilary Seligman from the University of California, San Francisco. And that's been instrumental in getting their background and expertise in terms of informing our process, informing the framework, informing things going forward. So where a lot of what I've been working with is more of the ideation phase. And what we're doing in this phase is we're having listening sessions with stakeholders. I'm going to basically conducting a federal data inventory to look at what available data there is to inform measurement of nutrition security, where there may be shortcomings, and then we have conducted expert interviews with different people in the field. We also look forward in terms of, as much as possible, bringing in stakeholders from a very wide variety of backgrounds, people working, for instance, in like food pantries and local food assistance organizations, as well as people with like tribal affiliations and people working with more marginalized populations. So this is just a sort of diagram I put together of how we're trying to sort of operationalize the framework that Ed presented earlier, where you have a lot of what happens in terms of nutrition security is based on individual circumstances and decisions, but those are influenced by social and cultural support networks, as well as food systems and greater food systems and policy. And so what we have found so far is in kind of like trying to develop broad measures, say, of individual characteristics and needs. We have a lot of data available on those things, both from the little knife and fork over here represent if it's available, say, through USDA or food system related data sources, and the heart with the pulse in it relates to if there are other like data sets available from CDC, for instance, like in Haines, where there's healthcare information available, or like health-based information available. And so we've been able to, of course, locate a lot of, basic information about people's things, like if you're a man versus a woman, you have different nutritional needs. Your nutritional needs change as you age, and perhaps other physical characteristics. And where we would, love to have sort of like data would be on, more family history and those sorts of things, but we're looking more just at the individual in, you know, time T. And then we have information to some degree, well, for quite a bit of information in like USDA databases about dietary knowledge and information use, and through Hanes some information as well that can be collected through data there. One of the things where I think there's great potential to expand data is in activity level and understanding how that interacts with other variables in people's lives to affect their nutritional needs. But that's one area where we definitely do not have a lot of information or data available from food systems type sources. However, we do have some information about life stage, but most of the information here on activity level, life stage, and lifestyle would be associated with health-related data sets. So I put in this symbol here on the right to represent these cases where there's poor data linkages or challenges to trying to build this complete picture of what makes up someone's individual nutrition security. Probably where we have the greatest potential to understand context is at household level through Hanes and data sources such as food apps with the USDA. We have lots of information about people's household size, race and ethnicity, income and employment, and food security. So that's good. One challenge though with a say survey like food apps is the frequency is only once every 10 years at this point. But there is a lot of opportunity here to understand more about social and cultural support, which kind of relates back to what Dr. Cotwright was discussing when she was talking about social determinants of health and our opportunities to bring those in to understand more about how they play a role in nutrition security. One of the areas where we have a lot of data from USDA side is on things related to food access and assistance. We've done a lot over the last decade to map people's say neighborhoods to local supermarkets and places where they can buy and access healthy food. But then a lot of times this isn't integrated with the greater public health data. We also, one thing that has been found by international researchers in like the World Health Organization to be pretty critical to nutrition and well-being is the availability of healthcare workers in a community and the utilization of those healthcare workers. Often they're sort of the first line of defense in terms of identifying critical nutritional needs and referring people to resources in their communities. And so this is one area where there's more information, typically in databases such as Hanes or BRFSS, but there's less information integrated in with USDA or ag and food databases. And then another thing just that has a big bearing, of course, on nutrition is affordability of nutritious foods, and that's influenced by food market structure and prices. And here again, we see this, so it's sort of at this larger food system and policy level that we see more challenges to creating these data linkages. And also, I put here at the bottom, food consumption, location, and source. We found over the last couple decades of research at ERS that there's a lot of, a lot of changes going on in the American diet as far as people eating more food away from home, eating through now having food delivered from apps. There's a lot of changes in terms of where food is being consumed and where that food came from. And while we've been able to track it pretty well, we have, there's less linkages between that and health. So when we think about developing a nationwide measure of nutrition security using federal data, I hope this provides a little bit of a sort of primer on where we're seeing opportunities, and we think that we'll be able to make data linkages, and where there's some challenges and needs for improve data. Maybe sometimes these could be complemented with some of the brief questions that have been mentioned earlier. Right now, we do have work where we're using the Healthy Eating Index, which uses the NHANES first day dietary recall data to estimate the healthfulness or diet quality of diet using the dietary guidelines for Americans on a scale from 0 to 100. Right now, the average American diet is approximately a 58, which if you think of a scale of 0 to 100 is, I guess, you know, we might be speeding, but we are not a fine-tuned machine as a average American diet. And so this isn't surprising though, given the high rates of diet-related diseases in our country, and already there's a lot of evidence showing that Americans are consuming too much added sugars, sodiums, and not enough things like fresh fruits and vegetables. So as we're working with the HEI to try to understand what it can explain to us about nutrition security and how it might help us identify additional elements of people's lived experience and environment that may affect this diet quality. So, and one thing I just want to add here at the lower box here is the HEI. It is composed of two simple general groups of food, and the moderation components are those things that we should have less of, or that if you have too much of them, they can lead to things like high blood pressure, diabetes, things like refined grains, sodium, added sugars, and saturated fats. And then on the right-hand side here, we have the adequacy components, which are things you want to make sure to get enough of to sustain a healthy outcomes and avoid things like anemia or other afflictions. So those include things like vegetables, greens, and beans, whole fruit, whole grains, dairy, and protein. So the more people have of those, the higher their healthy eating index gets, assuming that they decrease the moderation components. So I hope this has helped you kind of understand at least our general thinking about the process that we're going through to develop a nutrition security measure. As I said, we're I would say sort of at a midpoint here of we've spent a lot of time with the conceptualization and definition, and we will continue to circle back and return to this as we learn more through the ideation, prototype, and testing phases. So this year, so this gives a timeline that actually starts. So I'm just kind of in 2022 is when the framework development started, and then it was published this last August. We also started a baseline report using a healthy eating index as a proxy for, or at least kind of help to identify issues that may be related to nutrition security last year, and are looking forward to publishing it later this year. We have ongoing modeling going on with that to try to identify the data and data sources that might be used on a federal level. We're presenting to you today. Next week will be, next week and next month, we will be at the Healthy Eating Research Conference, where it is a conference that is sponsored by the Robert Wood Johnson Foundation, and we'll be working with experts there to try to get their input into their ideas and needs around a nutrition security measurement. We have tentatively proposed a workshop pending NEFA funding to look then more closely at the modeling process for nutrition security. And as I mentioned, we'll have our baseline report out later this year. So in terms of my federal and USDA team, I just want to introduce the people I've been working with. Alicia Coleman Jensen, she's at ERS, and she's worked extensively on the food assistance reports that have been done over the last decade or more. We have Joanne Guthrie, who's a nutritionist, also working with food assistants, and Christian Gregory, another economist working as food assistants. I'm also working with Melissa Ebelev. She's at the FNS division of USDA as a deputy administrator for policy support, and Tuso Rebecca Panucci, who is the director of the CMPP program and works closely with the dietary guidelines for Americans. So I do hope if you get a chance, I'm really interested through the Q&A, or if you would like to put comments in the chat in terms of what motivates your interest in nutrition security and its measurement. We are, as we continue to work through this, always interested to hear from our audiences and other stakeholders about what they're thinking about nutrition security, what that brings them to them, and if they had a measure, what would they do with it. So I think, well, I have my questions as my last slide, and we'll also be turning over to have our Q&A.
Thank you, Mariah. At this point, we'd love to hear from everyone. If they have any questions or comments about what's been presented today, or if you want to answer Mariah's question directly, here's a poll that you can participate in partly, but we're happy to turn this over for your questions or comments.
Shelly, this is Chloe. Can I just jump in with a question?
Please do, yeah.
Great. No, this was fantastic. I learned a lot, and I think this is a great effort. One of my interests, and I think the most exciting, or one of the most exciting parts of the presentation today, was the idea of having more timely measures of hardship, conceptualized broadly, including nutrition hardship. And this is something I've been thinking about a lot, especially coming from sort of the econ/policy world perspective. It seems like there's a lot of attention and focus on timely measures that are not focused on economic hardship. So like, for example, we talk about the unemployment rate and GDP and inflation quite a bit, monthly, if not more often. And of course, those things impact hardship, but it has always felt to me like having a sort of more timely measure of these direct hardship measures would be really valuable to have in the conversation. And to sort of complement some of these other more aggregate economic indicators that we spend so much time thinking about and talking about. So that was just kind of my reaction, and I don't know if it's really a question, but just that's my thinking about it, and one of the things I'm most excited about. So I'm kind of curious maybe if you all have thoughts about that sort of timeliness piece as well.
I think I really, yeah, I've been thinking about sort of similar things in terms of as we think about what we are measuring. I think that what has brought us to this point of an interest in nutrition security is kind of like what Dr. Cash mentioned. It's part of a larger system sort of approach. And also I guess part of this is me coming to this as I've been working a lot with nutritionists, but I am likewise coming in as an economist. And I thought, well, we don't necessarily, when we say, how's the economy doing? Well, that takes you to a few different things, right? You think about GDP, you think about unemployment, inflation, interest rates. And so I think when we think about nutrition security, there maybe we will reach a point where we have, a single index, but it is going to be a compilation of different things, and the timeliness is is something one thing I left out of my diagram was the time dimension, because nutrition security, I think this is one thing that is a challenge, say, to using the HEI to measure it, is HEI is just 1 day of diet, and nutrition security, your nutritional well-being, is built over time, at least the short run, if not the long run.
If I could just add a comment to that, I think that a couple of things I wanted to mention is first of all, this work that's going on in the U.S. is a really important example that's happening in parallel to a global effort that's being coordinated by one of Sean's colleagues at Tufts and myself, where the leadership is coming from 3 UN agencies who are working together to develop a way of assessing on a regular basis the healthfulness of diets. And so the work that's being done, there's a lot of parallels and crosstalk between the 2 projects. So this is a big issue globally. I think the issue that Chloe raised is really important. One of the arguments that I made, because I was presenting to a group of global donors a few weeks ago, was that we really need innovation in terms of assessment. So I'm glad to see some of the efforts that Sean summarized. But legitimacy is going to come when we not only come up with innovative ideas, but we can show that they really work, that they're really valid, and that they will stand up to scrutiny. There has to be that, but then there also has to be endorsement, a process that Mariah described for lending legitimacy, and that's what the role of the USDA and other partners will be, is in putting out something that has legitimacy. And that's why the food security scale has worked so well, is that it's had both of those things. I think that having brief measures and indicators is really crucial, because then they can be used in lots of different situations, including rapidly. I mean, during COVID, we were challenged by needing to know, not on an annual basis what's going on, but like what's happening now. And so, there were these pulse surveys, household pulse surveys that were done. And some of the items in there were ones that were well established, and that was really good. And some other ones were kind of created, and that wasn't so good because we don't know how much we can trust them. So I think all of this work is, in having people's input is crucial, because we want in the end to have methods and measures and indicators that we can deploy when we need to and in the timeliness that's required.
Great, thank you.
We have a question from the chat. I'll go to that first, and I'll get to you, Katie. I see your hand up. We are interested in methods that combine assessment of the respondents' knowledge of the healthfulness of food with the nutrition security questions. It's easy to know if you cannot afford food. Assessing ability to afford healthful food is more challenging. That's an experience question. I can understand it. It seems like it might be difficult to do in a brief survey. Any one of our panelists want to take that on?
I think that I think that's a really important point in question, because it's not just going to be a source of measurement error. It's likely to be a source of measurement bias if you look at these type of self-reported questions that some of these short screeners have used, right? Because you're asking people about their ability to access healthful foods, or if they've skimped on purchasing healthful foods. And so if my knowledge of what's healthful is limited, I'm not just going to have an error there. It's going to likely be that people with more knowledge, holding everything else equal in terms of access, are going to be more likely to report perhaps nutrition insecurity than people with less knowledge, right? So, and also then those measures are going to fluctuate. Those types of measures would fluctuate as knowledge fluctuates as well. So if you have successful population health level campaigns, or something like front of package labeling, you could have no difference in access, but a difference in understanding. You get very different measures. So those are definitely limitations of these short form instruments, I think.
Joanne, did you want to add more context?
Yeah, I just wanted to mention that that has been shown in previous cognitive testing work with the Census Bureau to be a problem with the quote unquote balanced meal question in the food security sale. This is obviously a question of knowledge. It's a question of culture. Also, I think Ed made that point, what you could consider to be a balanced meal. And that is really one of the biggest problems that food security, we're trying to tap adequacy, which is, a sort of a one-dimensional construct, one might say, or certainly simpler than nutritional well-being, which is multidimensional. The nutrients, the food groups, as we know from extensive dietary guidelines reports and healthy eating indices and so forth. So the ability to establish that we're all measuring what we think we're measuring in a short form is at the heart of the challenge.
Katie, did you want to ask a question?
My question was very similar to the last one, just thinking about the construct validity. Like, I don't have a great sense that people know what nutritious is. And I don't think like the popular media's discussion of the American diets can give a kind of a stable answer. So I think it was kind of answered already, like, what are we measuring if people don't know what nutritious is?
Yeah, if I could comment on that, that's a challenge with. I mean, we know that there's some successes. The food security measure works well, and the measure that's used globally was based on the USDA measure, so it works well because we learn enough about what are universal experiences that transcend culture to a great extent. The balanced meal item in food insecurity is the weakest one in that regard, but the others work well. Other successes are, we know that there's an item that asks about, how do you rate your, the self-rated health from poor, fairly good, very good, and excellent, whatever those are. That tends to work very well in a sort of omnibus, holistic way. But your overall point is really important. That's part of the reason why we have focused on what is universal, and what's universal is that there's adequate nutrients, that people are moderating their intake of foods that provide a lot of energy but not a lot of nutrients and have substances in them that are actually detrimental, et cetera, so that we focus on what's universal. And I think we'll need probably to have a mixture of data like that we're very confident are universal, and then other data that are probably more contextual, cultural, social, that can maybe complement that. I think I was also going to mention that one of the things that we've learned already, there's a paper that'll come out soon, I think, that was developed by people working at the Food and Agriculture Organization, but we're seeing this in our own analyses, that measures that combine different subconstructs or components, if you like, together are actually obscuring things that we need to know. So it's finding there's a need to find a balance between what are the separate pieces of information we need to have, from having it be relatively simple and straightforward and usable in that way.
Other questions from the audience? Cameron, I see you had a question similar to the ones before. If you don't think it was, if you want to give more context, please jump in. In the meantime, I see another question. What role does diet culture play in people's perception of nutritious foods? When referencing diet culture, I am speaking about the popularity of foods deemed good, like greens, powders, protein powders, smoothies, etc. Any of our panelists or audience want to take on that question?
I just have sort of a comment, yeah, along these lines, and that is one of the, I think, I don't know, it's almost like a paradox of this is when, so I've been spending a lot of time with the NHANES data, and there's two questions there. One is, well, there's really three questions kind of related to diet knowledge. And two of them are, do you use the facts panel, and are you aware of MyPlate? So those are two, like at least USDA kind of highly relevant items. And then there's a third question where people assess their own diet. And it isn't really, it's not related to, you know, any of those formal programs. And what is interesting is the one that does relate the most strongly to a higher quality diet as measured by NHANES is the one on just dietary self-assessment of, do you think you have a good diet? And so this isn't really answering this question well, in that has led us to think, okay, so what are people thinking is good? What is coming from our programs such as food labeling and MyPlate, and what is coming from more general social concepts of a good diet? And sometimes I think too, when I've realized when I am in my sort of professional circles and we talk about diet, we tend to have a broad view of diet. For some people, the word diet just means trying to lose weight. They are otherwise not on a diet.
I wanted to chime in just from the context of being a nutritionist and maybe reading more nutrition literature and the balanced meal question. I think that the popular messaging that people get about what is a healthy diet is, somewhat obscuring, because they may be assessing on that basis, and it may not be very reliable. And the other thing is, I think it would have big impacts on their sense of whether a healthy diet is affordable. If they assume that shopping at Whole Foods is necessary for a healthy diet to be affordable, they would think very differently than maybe someone who was raised, let's say, in a thrifty vegetarian household, who would say, oh, lentils are an excellent source of protein, that sort of thing. And that, I think, is really a challenge when you're talking about assessing whether the economic constructs underpinning some of these questions about nutrition security are meaningful. Is it really affordability that's blocking them? It is if their frame for healthy foods is one that's bounded by shopping at Whole Foods. It might not be if their frame is a little bit more expansive. And then that becomes an issue if you're starting to think about like what your policy intervention should be.
I have a question for the audience, and this is to get a little bit more of your input. So as Dr. Cotwright said, advancing nutrition security will take a whole of society approach. And I wondered if you think of there are groups that we should be interacting with as we develop these measures, either academic groups or nonprofit groups or anything. If you could, if you have any you want to share, please do, and raise your hand and share, or please put them in the chat. We're, as we said, we're kind of in a stage of seeking input as we go along here, and if there's some groups that you think we should talk with, we'd be happy to consider that.
Yeah, if I could just reinforce what Shelly's requesting. Sean did a great job of, I think, helping us understand some of the sort of questions that the research community might have and would benefit from having a measure of nutrition security. But to really, researchers are important, of course, but there's many other actors in society, and we need to have input from them about what they're thinking and what their needs are. Sheila, why don't you go ahead?
Yeah, and again, apologies, Dr. Caree got pulled into a medical appointment, so she wasn't able to make the full Q&A. But again, I think from, her heartfelt remarks earlier about emphasizing the whole of society approach, like that very much is coming from this administration and from our secretary. And I think yesterday's End Hunger and Build Healthier Communities Challenge really showcased it is taking a whole of society, and many folks from across a variety of innovative sectors are stepping up and stepping in. And so again, I think even in this metric space, or even the questions about what is nutrition, and again, seeing kind of a primarily public policy and economy group, it's interesting the questions you guys have or the observations you guys have about nutrition. And those are really important because, if we are trying to kind of create a measure that is cross-sectional across this country, I think we have to understand like how these questions and these terms resonate with folks. So very, very much appreciate the questions today, and very much appreciate the efforts by this group to really think through the key sectors that will help us with measure development, and then ultimately, using the findings from this measure to impact change. So really, really appreciate these multi and transdisciplinary efforts. For USDA, one of the key places we've been leaning into, and that was highlighted with the work highlighted earlier from Kaiser, is thinking through, where and how we can improve integration of food security screening, and as Kaiser's doing, nutrition security screening. So again, there's that balance of the types of questions and instruments that will be used in different sectors. So it's probably not going to be one size fit all, right? Like that there's an 18 question module, and then there's various versions of that are shorter. I think, again, it's going to be a variant of those. And I think there was questions earlier about thinking through, diet quality. Like some of these questions are going to be the cross-sectional national study ERS is going to be capable of. Some are going to fit better as kind of smaller scale studies that will inform hopefully larger scale intervention. So I think it is a very good mix of these different types of concepts that are going to be helpful. And again, for us right now, we are kind of thinking and conceptualized within healthcare, where they could do those screenings, where they could do those warm handoffs, and thinking through where, short questions might help, just knowing that is often a trusted partner in many people's lives, and often an intervening point on kind of food and nutrition health issues. So I think thinking through other sectors where, there are trusted touch points are really of interest to us in terms of thinking through those types of questions. And then for us, thinking through, just really touching everyone in this country and thinking through kind of those key community organizations that have meaningful touch points. So those are food pantries, or within kind of more of a church or faith-based context. I think we have to think broader about where some of these at-risk populations are engaging and will trust the people who are asking these types of questions. And hopefully when they're asking these types of questions, have the warm handoff to something that will hopefully connect them to ways to advance their food security. So again, thank you so much for today's dialogue. Dr. Cotwright is sad she was not able to be a part of this Q&A because as an academic, I think she very, very much loves this discourse and really the potential that is happening here in terms of metric development and hopefully longstanding intervention following from this work. So thanks.
Thank you, Sheila. I see we have a question about maybe to distill it, the role of the juxtaposition between community food nutrition security and individual nutrition security. And I wondered if any of our speakers had thought about that as they're developing their measures, or think of it as a different way to monitor and surveil the population.
I would say yes, we are thinking about that. And that is a challenge. And so, and that I think I maybe didn't communicate it well with a couple of my slides, but that is sort of the challenges. I actually, in thinking about this, I'm kind of thinking that, I think we think when we're making a decision to eat, a lot of times we're making a decision about what to eat. But that decision came after we decided where to eat, who to eat with, and where we would get our food. And so context is important, and so getting and sort of triangulating that was measurements of context versus the individual characteristics as needs is important. I know just personally, I even just watching like life transition, going from raising, as I raise kids, my nutritional needs sometimes aren't met if I'm meeting my teenagers, right? So so there's differences.
Yeah, I just want to
I
add
didn't
to
raise
what-
household versus individual either, but that's obviously another big component. Sorry, Joanne, please go on.
Yeah, I just want to add to what Mariah said, and I think that she actually alluded to this earlier, that, you know, we make decisions based on availability around us, and the access and availability part of the component brought it up. And so understanding the larger food environment, the surrounding stores, and what's available to them, and that sort of thing, via tools like ERS's Food Environment Atlas, for example. I think that's certainly really important, and that might be an approach that some of our programs, like, for example, the Policy Systems and Environmental Change part of the SNAP Ed program, they might want to look at things sort of that in that context. You know, what is the likelihood of being a nutritionally secure county, let's say, and what would that therefore say for your focus if you were a SNAP Ed director, where you want to put your attention? It seems like because this is a social behavior, a cultural behavior, an environmental and economically grounded behavior, it is really important to think about that. And I think that's a really good aspect to have brought up.
Sheila, do you want to add to that? You're on mute.
Yeah, I'm echoing Mariah and Joanne's comments here, because again, when I think of ERS, I do think of your potential to hit individual, but more so in the annual food security report household, but also, as Joanne is alluding to, a variety of other metrics ERS has it that really do look at those environmental aspects, but also just broader food supply aspects. I think from a USDA perspective, when the definition was getting kind of refined, plain language was a key piece for us, and also where we fit into it. So again, some people will criticize that it had a heavier focus on food access than maybe others might look at, but we think it's important, right? That part, I think, is very much where we sit in the game in terms of being able to think through our ability to help all Americans and everyone in this country have access to healthy, affordable, and safe and equitable foods. And so again, I think thinking through measures that capture that are very, very important to this evolution. And again, I think it's a balance of some individual metrics, some household metrics, community metrics, and then hopefully some national and global ways to look at these issues too, and hopefully progress on them.
I think we have time for one more question. All right. If not, please help me with virtual applause and a round of applause. Thank our speakers and our active participants today for your engagement. We really appreciate it. I hope you found the discussion as insightful as I did. If you have further questions, suggestions, or feedback, I encourage you to contact me. I can put my email in the chat, or Mariah Ehmke. I'm sure she had her email on the end of our slides. And please keep an eye out for further opportunities to engage with our research team as we seek feedback and input. Thank you again to APPAM for hosting. We're very grateful, and thank you all for participating.
Thanks, everyone.